Welcome back to the Chatty Vets Pod. I'm Brendan.
And I'm Charlotte. Thank you for tuning in.
We've somehow managed to make it through another month. Thank you so much to everyone who's been listening so far, and welcome to our 7th episode.
Yes, thank you very much. We hope you enjoyed last week's bonus episode, which ended up being a double bonus episode. So well done if you made it through both parts. We covered dyspnea in small animals, but today we're back with our next 2 Week Takedown episode, where we aim to bring you up to date with all the latest news and products in the UK from the last few weeks.
Okay, we've got a busy show ahead, Charlotte. We're covering topics from euthanasia tactics, dog chews, the good and the bad, allergy testing, parasites, and steroids.
Sounds good. So, okay, where should we start? Maybe let's start with something we can get our teeth into: dental chews in dogs. I don't know about you, but whenever I say to a client that their dog has dental disease or tartar on their teeth, they're always really surprised and say something like, well, that's strange because they have a dentistix every day. And they're even more gobsmacked when I start to discuss with them about brushing their teeth as an option. Or can you even imagine a general anaesthetic for a dental?
Yeah, I could totally agree. I totally get that every day. People are so... Do you know the other thing that absolutely amazed by? It's when you say that we might have to extract some teeth. They're just like they're just like the most extraordinary thing anyone's ever told them. Yeah, like, do you not know every dog and cat?
You want to take my dog's teeth out?
But Charlotte, how's he going to eat?
Yeah.
It's just like every consult.
Yeah, absolutely. Yeah. But I don't know. I mean, I don't know. I think the big thing that I find difficult is recommending dental chews, because clients always go on about, well, what chews would you recommend? And that must be the thing that helps. And should we use bones? And what do we use? So I quite like Whimsies. I don't know if you've got them in the practices that you work at or anything, but I used to use them in my little Labrador, and I use them in my collie now. She loves them. I find they're not super calorific. They tend to do a fairly good job, and they tend to quite like them. But I don't know about, I obviously still brush her teeth every day, which she still hates anyway. She runs away from me every time I do, so I have to bribe her with a treat afterwards. But I don't know about you. Is there a particular chew that you use, or what are you recommending to clients generally?
Well, look, I've not used Whimsies. I'm going to give them a go. And the 4 dogs I've had as an adult, I'm ashamed to say, failed to brush any of their teeth. And one of my dogs, I had to take out about 20 teeth out when she was 10.
No.
Yeah, and all the other staff at the practice were like guys at Bromley, sorry about this, but they're all aghast. They're all like, you're such a bad man. So, well, I use it in my consult. There's 2 things I use in my consult. One is my confessional about never brushing teeth, and my confession about always having overweight dogs. So,
Yeah.
and I use it to my advantage. So I kind of go, so I'm not talking down to them. I'm not making them feel guilty. I'm not getting them stuck. I'm like you. I'm just as awful as you. But then every now and then, with an owner that does brush their teeth, I feel like they might kind of go, "Oh, this vet's not after much." So, what do I'm a bit of an advocate for chewing, but I know I think this really divides everyone, chewing, doesn't it? So in terms of antlers, obviously. And my dog's just been chewing an antler. And then what's those the really hard? I don't think they're rawhide. They're something else. They're like a Goldie. Maybe I should have worked this out before we started the podcast. No good. Okay, scrap that. Anyway, antlers and anything for chewing is and then I kind of match my hard chew to the dog. So if I've got like a really fussy miniature poodle, I might go chicken's feet. Or whatever. And the other thing I get them to do is to watch the dog when they're chewing. And I try and encourage them to look, does it look like it's a good workout for the teeth, or are they just crunching it into pieces and swallowing it? Because you know how owners always go, oh yeah, pig's ears or whatever. It's like, well, when I watch some of my dogs eating a pig's ear, they just crunch into pieces and swallow it. I don't think it's a workout.
Yeah.
So I try and encourage them. I go, something that's going to last 5 to 15 minutes. I do some of the tree roots as well, Anko tree roots and stuff. Just anything that's a workout.
Yeah. I mean, I know there's a lot of people out there that are going to go, you should never give dogs antlers. Like, it's just something you should never do. But I always used to. Like, I used to have a working lab, and she loved them, especially if they still have the velvet on them. Oh my God, she'd go crazy. And but she was the type of dog that she'd spend hours and hours and hours gently chewing. So it was great for her teeth. if she'd have been the type of dog that would have just wanted to smash it to pieces, they're the types of dogs that are going to fracture their teeth on those sort of hard products. So I think it, like you say, you definitely tailor it to the dog. Like, are they going to spend hours chewing and getting that plaque off, which is ideally what we want, or is it going to cause them injury? But I think, to be honest, most things I'm okay with, I think within reason. And I think, like you say, as long as it's tailored to the dog, the majority of the time, I'm not like, no, never do that. But sticky subject that I wanted to bring up, what do you think about bones? Have you ever given your dogs bones to chew on, or do you say definitely no in a consult? What do you say to owners?
Do you know, throughout that, I just remembered the name of the hard chew. I had to I have
Did
to
you?
say it now before I forget it. Nyla bones. I don't know.
There we go.
Right.
Okay, fine.
I'm not going to promote Nyla bones. Only that. Oh, I don't know if I'm going to get anyone in trouble now. But anyway, puppy raising for the guide dogs. Someone from the guide dogs gave us a Nyla bone for our puppy. And she's kind of like one of the people that's like really in the guide dog thing. And I was slightly horrified because at that point, I think our guide dog was about 4 or 5 months old, so, not 6 months with adult teeth. And she gave her a
Yeah, fragile
hard
teeth.
Nyla bone. But I mean, admittedly, she loved it, but I was a bit kind of like, well, I'd never do a hard chew for baby teeth. But then
No.
this experienced lady from the guide dogs did. So anyway, in terms of bone, going back to your question, I'm not against them, but I don't volunteer them out of my mouth either, which is such a weedy thing to say. So if people go, "Oh yeah, I do a massive ham bone or whatever," I'm good with it. I might gently venture kind of like, oh, people say cook bone can splinter, but I try not to actually get people's backs up and kind of go, well, oh, it's dangerous to do that. It's dangerous. I just don't think that's a good communication tool. I think things go a bit smoother if you just kind of just, oh, well, some people say that they can they can splinter
Yeah.
in the tummy or whatever.
Yeah, I mean, I have to admit, up until super recently, actually, probably like in the last couple of months, I've always been really anti bones. I think just because of what I've heard from various people, like in any respect, whether it's like in their food or for a chew, cooked or uncooked, I've just always been worried about, if they're going to splinter and you're going to get sharp injuries to the esophagus or to the GI tract, and then you get like a peritonitis, or if you're going to get a foreign body, or just the risk for me just seemed a bit too much, or even just fracturing teeth because they're so hard. But actually, I went on a certificate day, I think it was about a month ago now. And honestly, the stuff that the surgery guy was telling us, he was a surgery specialist and he was talking us through all these ECC surgeries. And honestly, I was absolutely amazed with what he told us. He showed us a picture of a rib bone in a dog's stomach that obviously had pinched from someone's Chinese or something like that, and said, okay, like to the room, what would everyone do? And most of us said, well, we'd go in with a gastroscope and fish it out because you don't want it to cause a foreign body or rattle around in the stomach for ages. Or some of us said we'd do a gastrotomy and remove it. But some of the people in the room said they'd leave it. And I was like, you're going to leave a massive bone in the stomach? What are you doing, you crazy people? Anyway, turns out I was completely wrong. Those people that were like, leave it, were like actually potentially right. So he showed us another image. And it was a few hours later, maybe like 4 to 6 hours after the dog initially presented. First x ray, of really obvious radiopaque rib bone in the stomach. 4 to 6 hours later, I'm pretty sure it was, a few hours later, regardless, he showed another x ray and you could barely see it. The stomach acid had dissolved this bone to such an extent that you could barely see it. So I think it's just made me think, do we actually need to worry that much? Because if the majority of bones, I mean, obviously, don't get me wrong, if they're sharp and they splinter and cause problem in the meantime, or they start to pass through before they become dissolved in the stomach, they're going to cause problems. But it's just made me think, actually, maybe we could be saying to owners an option is to just wait and see what happens, because maybe they will be fine. So I don't know. I don't know whether that's really common knowledge and it's just something that I didn't appreciate, but I don't know whether you knew that already. But yeah, it just really surprised me because I've always been like, oh, get it out right now. So yeah, I just found it really interesting.
Yeah, no, I mean, obviously dogs eat bones all over the place, don't they? And they're fine. I mean, the great
Yeah.
example of eating bone in our pets is cats as well that hum. And they're
Yeah.
eating. So I do think there's an element of matching the bone to the dog, and getting them used to it, and things like that. And the other one is, owners always worry about choking, don't they?
Yeah.
Don't know if, yeah, you
Yeah.
get that.
Yeah. Well, I would always say if you're going to give them something like a bone, as soon as it gets to the point where it could be small enough to potentially get near to swallowing, get rid of it. Don't let them have it anymore. Because when you've got something that could get lodged, there's absolutely no point anymore. Yeah. I think the only thing that I worry though is, you must have seen those like English Bull Terriers, for example, or Staffies, where they love a tennis ball or they love a ball on the beach, and they've all got completely worn down premolars and molars. Like you can barely see them; they've worn down so much. And I'm like, oh, do they chew bones or anything? No, they just love a ball. And I just think, how? But that's soft. You can compress it. How are they wearing down their teeth so much from something that's so soft? Yeah, I think that's the only thing that I worry about with them chewing on things like bones, etc., is if that in theory dogs can do that much damage with something soft. I don't know. Maybe it's something that we should be more wary of.
I'm going to say something controversial now. I know people say it's the don't they say it's the sand or the grains of sand in the tennis ball in the fuzz that
Maybe.
that rub against the enamel and wear it down. And I think as they wear down, and like you say, they can wear pretty much down to the gingiva, can't they? But I think
Mm.
I've read anyway that the nerve just kind of gently withdraws, so it doesn't they don't get nerve pain as the enamel wears up to the
Oh,
nerve and beyond.
yeah.
Probably not the right terminology, but that to some extent, because I've never seen one with um, obvious mouth pain. And the controversial
No.
thing I'm going to say is all of those, especially collies that have, and etc., that have like 2 millimeters of tooth, the gums are beautiful. There's no tartar,
Yeah.
there's no gum disease. And if the nerve, because my main worry was, is the nerve exposed, pulp cavity exposure, and all of
Yeah.
this. But apparently, as I say, from what I've read, it's slow. So I don't know, because on the other hand, I've got 90% of the dogs and cats I see have got ghastly gingivitis, gum disease,
Yeah.
pockets of pus. If everyone was brushing their teeth, then this tennis ball thing was a massive, yeah, okay, let's try and avoid that.
Mm. Never thought about it like that. Yeah.
Yeah,
I'm
so
not sure.
that's what I have to say about that, but controversial, so I do slightly shrug, but then, that's
Yeah.
human nature. Do you know, in terms of chewing, by the way, I read an amazing thing by someone who was basically saying chewing in dogs is like a really do you know the 5 freedoms? Do you know about
Yeah.
welfare concept, yeah? You know that? Well,
Yeah. Yeah.
could you argue it's a chewing for a dog is like one of their natural behaviors? Like,
Yeah.
you
I
don't
guess so.
you don't
Yeah.
see a squirrel chewing,
Yeah.
they're eating, they're not chewing.
Yeah.
Dogs chew.
Yeah.
It's a fundamental part of being a dog, you could argue. And this article is basically saying that it probably releases, and I don't know how much science was in this, but essentially they feel good by chewing. And
Yeah.
so chewing, yeah, should we be stopping them chew altogether? Maybe we should be finding the right chew for them. But that's kind of a discussion. What is the
Yeah.
right? But because chewing is so fundamental.
Yeah. Anyway, from one sticky subject to talk about with owners to another, one thing that we do and talk about all day, every day with our clients that just never, ever seems to get through is flea control. I don't know about you, but I have had so many FAD cases, so flea allergic dermatitis cases at the moment. So many dogs with fleas, so many people that are like, oh, I'm treating them really regularly, but they've still got fleas because they're using the crap stuff that they're getting over the counter. I actually read there was an article in the Vet Times recently, and they did sort of this in-depth look into parasites in sort of dogs and cats. And I just thought it'd be interesting to bring it up because I know it's something that we do and see every day, and it seems like something really simple. But one thing they spoke about, which I've definitely had clients say to me before, is whether we should be seasonally treating for fleas. Because I have loads of clients come in and say, well, it's the winter, so I don't need to treat them. And I've never really known how to respond because I've always thought, well, we should be treating all year round because it's not just fleas that are the problem. It's one, if you get them, how do you get rid of them? Because they're a bloody nightmare. Two, it's the things that they can transmit as well. So, but I don't know, have you, before sort of I go into what the article said, like, have you ever said something specific to clients when they say that to you, or what do you normally say?
I think that's the worst idea I've ever heard in my whole life.
Yeah.
Came up with that.
Yes.
That is, can we just say, I'm not. The Chatty vets are against seasonally treating fleas.
Yeah.
So, but I will say what I do, which is, but I think it's different for everyone else. But I tell you one thing: if you do this, you will win the trust of your clients, and and that is at the moment the most important thing we can do in that consult room. And what I do is I talk about. This sounds a bit airy fairy now, but I talk about what fleas mean to them and their household. So, What I mean by this is, how much risk have they got of having fleas? How would they feel if they had a flea infestation? So, and what are the consequences of having fleas? Now, by that I mean, if you've got a dog with sensitive skin in your house that you're constantly managing its allergies, maybe you're not the right household to not treat for fleas. So
Yeah.
that's that bit. If you have got 3 cats and 4 dogs, then again, maybe you want to just treat every pet every month. However, if you've got a 7-year-old dog with no allergic skin disease, that's the only pet you have. And if you're like pretty chilled about the idea, if you get fleas then you'll treat and you don't mind that fleas might happen. Well, okay, look, you don't have to treat for fleas. And that's less insecticide in your house, less insecticide traces in the garden, and less chemicals. And even though you could say, oh, less chemicals, it's all airy fairy green nonsense. But so many clients are on that page now. So, and I find I get a lot of all those people. If you just try and say, "Oh, here's your flea treatment," blah blah blah, there is a good 30-40% of your clients that aren't doing it, and they're not doing it but they've not been able to verbalize why.
Mm.
And when you have
Yeah.
this chat, suddenly you're justifying what they're doing, and you're winning their
Mm.
trust, and they're thinking that you represent them, like they're seeing eye to eye with you, and and that's such a I don't know, yeah,
I think there's loads more caveats to it than there used to be. Like, a lot of people are more aware of the environmental impact of using these sort of medications on our pets, especially spot-ons that are all running off into the ecosystem as well. So I think there's a lot of people out there that aren't wanting to treat for that reason and are wanting to use turmeric or something to get rid of them, whatever people try and use, like
yeah, garlic.
talcum powder or something, whatever. But
Look
there's
at our
sorry,
sitting
that was
gracious
probably
earth.
yeah, sorry, that was probably a bit harsh to anybody out there that does herbal stuff. But anyway, um, I think there
By
is
the
that to
way,
bear
did you
in
say
mind.
turmeric?
Yeah,
Turmeric is my favorite thing for supplements. Don't
yeah.
laugh. No,
The
I'm
only thing,
serious.
yeah, it is. But the only thing that I think is that you have to use it in such a massive concentration for it to actually work. No, like if you just sprinkle turmeric onto your food, it's not really going to make much difference. Like, I always thought that you had to use a hell of a lot of it.
Who knows? Who knows? But I know when I was at Bristol, when I was a student, they were doing their studies on turmeric and joint lameness and force plate analysis and all that. And they were like, yep, turmeric looks really good. And I might have got this, look, 20, 30, whatever years ago. So like, I might have got it wrong. But anyway, I thought that's my memory of it. And then I went home and told my mum, and she said when they were back in Sri Lanka when she was a child, if one of their chickens broke a leg, they would bandage it up and they'd put turmeric in the bandage around the thing. And I was like, well, you got those traditions that have gone on for thousands of years. There you are. Turmeric, sorry.
I think it's worth thinking about the way that we treat our animals for flea and worming treatment. And I think that there's definitely something to be said about potentially moving towards fecal egg counts before worming and things like that. I think there's definitely ways that I think parasite control is going to change. But for me, I just think, why are we not treating for fleas? I don't know. I mean, this paper, to take it back to what the Vet Times was saying, they were basically saying that a lot of people are coming into the vets and saying that they think they only need to treat their fleas in the summer or the warmer months, as this is when they're more likely to see fleas. And to be honest, it can be the case in some countries, but they've basically said that it's not really the case in the UK. So SCAP, that big parasite
Yeah.
company, yeah, they
Whenever I see that
basically
word, I
reckon,
always ignore the article, by the way. It's
yes.
so boring.
Yeah, probably because loads of people are switching off from the podcast now and
Yeah.
decided it's not
Just cap.
interesting. But
Right.
yeah,
Bye.
I'll be quick, I promise. So basically, they've said they definitely recommend year-round treatment in the UK, but in Europe it's slightly different because basically, if you're in a country where the temperature drops below freezing, it's lethal to adult fleas, so it's going to kill them off. So in the winter, fine, sometimes we don't get fleas. And as they're saying, as the climate's changing, we're getting milder winters in the UK. Whereby previously loads of fleas would have been killed off in the winter because we'd have got so, the environment's got so chilly. We're not really getting that anymore. So they're basically saying there's absolutely no evidence that says that not treating your pets year round in the UK is a good idea because basically we're just not reaching the temperatures anymore to kill off the fleas. So if anybody ever asks you, that's what you can say.
For me, the peak flea month was always September. Like as a GP nerdy type person, I actually made a mental note of this every year for the last 25 years. And peak flea season was September, and then it went to October, and then it went to November, But I was moving south as well, so this kind of makes it a bit harder to know. And now I don't know where it is quite. Maybe December. I don't know. And also, I used to always make a note of when the first frost was, not well, in before I was a gardener, and obviously the first frost is getting later and later and later. So yeah, that backs up a bit of what you're saying. I don't know if it does.
Yeah, yeah. And I think, to take it into back into a clinical context, they're not going to be killed off all year round, so you need to be treating them. Obviously, you need to think about the flea irritation, like your FAD cases. It's going to be a pain in the bum, so make sure you're treating them. You need to think about three flea-borne pathogens, so things like your cat scratch disease, so Bartonella, Rickettsia, Hemoplasma, tapeworms. All of these things I think it's easy to forget are transmitted by fleas. So you're not just treating fleas, you're preventing these infections. And I guess if people are really hesitant to treat, the only other thing that we can now be recommending to them is, have you heard about the Brevecto injectable?
No, I think Vets for Pets are doing it, aren't they, as an annual injection
Are they?
for dogs? Is that right? I
Yeah,
believe.
yeah. I mean, I think in principle it sounds good, but part of the reason why I really like Brevecto normally is it covers your mites. So it does Sarcoptes and Demodex. And I'm pretty sure, someone correct me if I'm wrong, but I'm pretty sure that the injectable only does fleas and ticks. So I don't think it has any mite cover, which is why I've not used it. But I guess if you've got those clients where they're particularly not treating for worms and everything because they just don't want to use any medication and they can't give their, say, I don't know, their animal won't take tablets. And for a dog, in theory, if the main thing you're worried about are fleas and ticks, then great, use the injectable because you do it once a year at the same time as vaccine and you're done. So I guess it's something to consider, isn't it? It's just not going to give you as full cover as some of your other medications.
I just thought, and when you're talking about Sarcoptes and Demodex, yeah, but this is to me, this is a little bit like my garden where I'm organic in my garden, and I just allow a few risks and a few things in that maybe I'm getting something better by doing that. But I mean, that is there's going to be people who kind of go, "Oh my god, what an idiot!" So maybe, but horse owners have done worm testing for quite a long time, haven't they? And I think, and also, did
Mm.
you? I felt really let down by Advocate. When I started reading that was long lasting in the soil. I can remember back to the studies where they put, I think they put like a UV marker in there, and then you look at the house after you've spot on your dog, and there's little traces of it everywhere, and you think, well, there's going to then be traces in the environment, and it's long lasting in the soil. Kind of made me feel a bit, gosh, how much Advocate have I sold in my time as a vet? And we all enjoy the outside environment. We all enjoy wildlife, but we've been killing it off basically with our
Yeah.
actions.
Yeah.
But it is a nuanced thing because, like, for those clients that don't do flea control and then they have a massive flea infestation, they'll probably go nuclear with the chemicals when the fleas arrive. And have you gained? How much have you gained? But maybe a few clients won't get fleas.
Yeah, and I guess from the animal's perspective, like I had one the other day, there was this, I think it was a big lurchery thing that came in. No, Irish wolfhound, that's what it was. Came in and it looked like it had mange. Like it had horrendous patchy alopecia, ulceration, superficial pyoderma. It was just, its skin was awful. And the guy came in and I looked at it straight away and I was like, it's on its caudal dorsum, it's around its hind legs. I said, I guarantee you that thing's got fleas as it walked in the door. And he was like, I don't think it's fleas, haven't seen any. And literally, as I was looking at the dog, I saw one crawl on it and I thought, oh. So you end up giving it antibiotics, Preds, Brevecto, like you end up giving it all this stuff to treat the then infection and the flea allergic dermatitis that it's got. And you end up giving him the medication anyway. So you just think, well, for the dog, it's probably better to just continue them on the medication that's probably going to do them less harm. But it's the environmental stuff, isn't it? That's the thing that's more tricky to handle,
Yeah,
but
but
I don't know.
it's okay not to. I think it's okay not to flea your dog. That sort of dog that will need fleeing for the rest of its life, as will the other members of the household that are furred. But
Mm,
it's okay not to flea your dog as long as you've got a reasonable sense of, like, being a reasonable owner and bring the dog in when it's itching.
yeah,
Rather, I bet you that
yeah.
guy's tried about a million different things.
He also said to me something that I've had that was a new one. He said he'd been using flea cream. Have you ever heard of this before? I was like, I don't know where the hell you've got this or how this was marketed to you, but I was like, I'm not sure how flea cream is going to help. And he was like, well, it's oily. I don't think they like it. I was thinking,
It's a
what?
lot of cream for an Irish wolfhound. Can we just go back? I want to watch the video of him using that cream on an Irish wolfhound.
Honestly, I was like, right, okay then. But I think you should use
Oh,
this instead.
electric
Here's
feet flip.
here's some medication.
Well, yeah, I find it really hard not to laugh at, like, when the things people use, flea bombs, obviously, electric flea combs,
Yeah.
flea powder, flea shampoos, and there's like all these things that
Yeah.
clients are just like, well, I've done
Yeah.
that. And yeah, and it's, oh,
Yeah.
you feel, we
But
think,
then I guess people, if you associate it for people that have kids, if you've had a kid with nits, you like comb the nits out and you put the shampooy stuff in their hair. That's how you get rid of it, right? So maybe that's why people think the same with fleas. Maybe that's why, because they're just like, oh, you just treat it when you've got the problems.
right?
Anyway, moving on to something a little bit more interesting. So we've done fleas and we sort of talked a little bit about flea allergic dermatitis, but maybe we should go properly on to allergies. And I wanted to discuss something that a lot of people talk about, but I don't think actually a lot of people recommend. Do you use allergy blood testing in your patients? Like, are you ever taking blood to find out exactly what they're allergic to, or do you not think it's useful?
I haven't worked it out yet because I spent probably like my last 15 years general practice working alongside specialists. So I'd
Mm,
internally refer them to see the dermatologist who would do
fine.
intradermal skin testing alongside the blood test.
Oh,
And
okay.
I don't think we did the food one. I don't know if she did. I can't remember. But so then I didn't really get the opportunity to go into that because it always seemed, because I know the dermatologist always said, oh, it's really good to look at the two together because you can kind of get a better desensitization treatment out of the end result than just doing the blood test. Now I don't have a derm specialist to internally send them to. I do need to get my head round the value of it because desensitization injections are okay. Because I would see a lot of the cases I sent to her, especially some cats, I'd get really reliable little things like the owner going, like, "Oh, the itch is coming back a bit, so we've come in for our injection." And you just get the feeling they wouldn't have done that if there wasn't a genuine benefit that they're seeing. So, yeah,
Yeah.
how about you?
Yeah, I mean, I think the only big thing that really puts me off the testing in the first place is the cost. And I'm like, if people aren't insured or they just don't have the money, I mean, like your routine one costs like 500-600 quid or something, isn't it? It's quite a lot of money. And I think ultimately it depends what you're doing it for, because if people don't have a lot of money and they think it's food related, I'll just put them on a food trial or put them on a hydrolyzed diet instead, which is going to save them loads of money and do pretty similar thing. It's just going to take you longer. Whereas if you're pretty sure it's environmental, if they've not got the money, then what difference does it make knowing that they're allergic to pollen versus grass versus, because if they're not going to do immunotherapy, then why does it matter? So I think for me, it's a very select patient that I would use it for, and also patients that are likely to tolerate injections. But yeah, if you can use something like immunotherapy, where in the grand scheme of things, it's going to be a far less harmful drug than something that you're going to have to use every day for the rest of this animal's life. And if it works for them, then great. But and I have had quite a few patients where it seems to really work well. To be fair, I've never really had any cats on it. It's mostly only been dogs. But one thing I will say is I have never actually fully started a patient on immunotherapy. I've only continued them on it. And I didn't realize, it's probably really stupid. I didn't realize that you have to slowly up the dose. I didn't know that. And I didn't read the data sheet. I just gave an injection.
Wow.
And then my
What
nurses
happened?
said to me about, they were fine. The dog was absolutely
Wow.
fine, thank God. So I called the owners and I was like, I'm so sorry. I said, how is he? And they were like, yeah, he's absolutely fine. Don't worry, we won't bother about increasing it slowly. We'll just go back onto the normal dose next time. I was like, cool. All right, then fine. So
Wow.
yeah, just be careful. Don't make the same mistake I did. But yeah, I mean, how many of your patients that you're putting on immunotherapy, how many do you think respond?
Well, I know what the derms used to say. Both dermatologists said the same thing. So I feel like, and this is the thing, but they both said 1 in 3, this is dogs, I think, but I think cats do better. But anyway, 1 in 3 dogs are a lot better. 1 in 3 dogs still need some medication to control their itch, but it's less. And 1 in 3 dogs, it makes no difference. I think, is that, are you hearing the same thing?
Yeah, that's exactly what I got told. And I mean, I looked at because Next Immune is one of the places that do it, isn't it? And actually on their website, they say that it's got a proven efficacy of 75%. But I'm like, well, what are you classing as efficacy? Are you classing it as working slightly, or are you classing it as working completely so they don't need to be on any other meds? And I guess if you look at that figure in terms of working a bit at least, then it probably fits roughly with our about 66% of dogs are going to respond okay to it at least. And yeah, anybody else has any cases or comments or whatever, then please send them in. Somebody might be really against it and someone might be really for it. So please send us your comments. We'd love to hear.
Yeah. I've just remembered that I've got a quiz for you, so I'm going to put you on the spot with a
Oh God.
test, and I'm
Oh
going to a
no.
test of yeah. So be
It's
prepared.
okay if I'm
Yeah.
rubbish and I don't get any answers right, I'll just cut it out.
Oh yeah, because you edit. That's so unfair. No, you have to. I'm gonna have to make you agree to broadcast it. Right. I know it's your least favorite area. I think is that right? Derm's your
What?
least
Oh
favorite.
yeah, I hate dermatology. Yeah.
Okay, your quiz starts.
Oh
Okay,
God.
Charlotte,
This is
you're
when I
on the
get
spot.
0.
What
Okay.
is the proper name for these typical presentations of skin allergy in cats? The proper name. Okay, you
Right,
ready?
okay.
You know when you get a
Yep.
cat coming with a fat lower lip, what is that called?
With fat lower lip.
Yes,
Uh,
I. You know that.
uh, Chinitis? Don't know.
You know what I'm referring to, don't you? You do. You do.
Yes,
Tell me
yeah.
you
I
know.
just can't
Yeah.
think
Okay.
what
Good. I'm
I
not going to
put
tell you the answer to
inflamed
that. I'm going to
chin.
the next one because you might come back. Hey, we need a look. Can we have a sound effect like? Next one.
Yeah.
Ulcerated upper lip, bilateral or unilateral, obviously.
What, because of allergies, or you mean
Yes.
for whatever
Oh my
reason?
gosh. Yeah, this is really good. Go on. Come on. For 1 out of 2. Yes, this is typical common presentation of skin allergy in cats. The ulcerated upper lip, unilateral or bilateral. You know, where the lip's being kind of eaten away in this kind of seemingly ghastly kind of disease.
Yeah, but I don't know what you'd call it. Is that really stupid?
What do you write on your nose?
Ulcerated upper lip.
That's what my question is. It
Just
says
explain it.
ulcerated upper
Yeah.
lip. Okay.
Yeah, that's what I write because I can't remember any of the terms.
Question number 3. Okay, try to kind of salvage some respect, just dignity out of this whole quiz. Oh no, I don't think you're going to get this. You know when they get a roundish pink stroke red lesion on the top of their neck, on the dorsal kind of
I don't know
scruff
if it's
area?
specific to the top of their neck. Do you mean like a collarette?
No, no, it's like a 1 inch, maybe by 3/4 of an inch, kind of oval, pinky red lesion on their dorsal kind of scruff on the dorsal part of the neck. Quite reasonably common presentation of allergy in a cat.
I don't know. I just describe it as a
You re
circular ulcerated
Okay, I'm
lesion.
gonna have to give you some help here. You know the term eosinophilic is gonna help you a lot here, don't you?
Yeah, yeah. Well, I
Oh,
think
right.
like if yeah, but if I think it's got like
Go
an
on.
eosinophilic is that what you mean? If it's got like an
Yeah.
so the fat lip was eosinophilic granuloma on its lip.
Yes, yes.
Fine.
Have
Okay.
I got this
Fine.
wrong? You're making me worried now. Okay, and then the
No, no, no. You're
ulcerated
fine.
upper
No.
lip is
Do you mean? Well, I'm thinking like a rodent ulcer, but it can't be if it's just
yes,
an
indolent
allergy.
ulcer, we
Or
used
do you
to call
mean?
it, but you can call
Fine.
it eosinophilic ulcer too.
Okay.
Yes, okay,
Fine.
okay, okay. And
Okay.
then
Okay. Good. I do know kind of what I'm talking about.
yeah, the ulcer on the back of their neck, I really like because I'll get it once or twice a year, or I don't know, 3, 4 times a year, and owners always come in with another explanation for why it's there, like my cat keeps getting this sore on the back of its neck because it goes under the fence, or it's from the cat flap and it keeps rubbing it against the
Yeah.
cat flap. Or have you had this? Or oh, the other cat's bitten. I had it last week. I had the other cat's bitten him, but it's a manifestation of allergy, eosinophilic. I think I'd call it an eosinophilic plaque, but I don't know.
Fine.
Sometimes it looks
Okay.
more
Yeah.
like an
Yeah.
ulcer.
Yeah.
Okay, last question number 4. Little scabs over the body that you feel more than see. What is the proper name for this typical common presentation of skin allergy in cats? The owner comes in, they go, "Oh, he's got these little scabs here and there, but you can't see them. But then you get your hands into the fur on their body and you go, oh, yeah, there's a little one, there's a little one, there's a little one."
Oh, do you mean like a miliary dermatitis or something like that?
Yay. Yes.
Yay! 3 out of
One,
4.
3. Oh, well, okay.
Kind of.
Go on then.
Maybe I get half a point out of 4.
No, do you know, I've just realised I put you through that, and now you're going to get me back at some point, aren't you? I
Yeah,
had
I
this
mean,
sinking feeling as soon as we got to the end.
yeah. No, you're fine. I mean, I definitely, yeah. I've decided to do more ECC for a reason. So it's yeah.
To
I'm
be
like, oh,
fair,
it's got
you knew
allergies.
all of them. It's just that the eosinophilic bit seemed to escape you, didn't it? So,
Truth.
well, we're talking about allergy. Oh, should we do? I think it's a more utilized thing, but topical steroid down ears as a preventative. Now, look, it's more out there, isn't it? Everyone knows about it. I mean, I've been doing it for
Mm.
25 years, but I don't feel like we've had the products but now we have. But I find it's a little bit mind blowing. I spent a little while trying to work out the difference between Cortevant and Resicort in terms of what's the best one to use. Or I always used to do my 4 mils of Dex in a large bottle of Epiotic, and I used that for years. And I wanted to try and work out in my head, what is the difference between all these three steroids down ears for preventing the ear problem coming back? Is this something that,
Yeah.
yeah, you get into?
Yeah, I mean, to be honest, I think so. I use more Resicort now because I think is it the only licensed one for that use? I can't remember why.
Yeah,
I think
makes
there's some reason. Yeah, I think there's one reason why I use that more if I'm just going to use the steroid on its own. But I always used to do a very similar thing to you in terms of steroid with ear cleaner. So I'd basically get like a bottle of Epiotic or even Otadine or something like that. And then basically I'd put in, I think I used to use 20 mils of Colvazone and shake it all up and just tell the owners to give it a really good shake when they use it and then just use it like their normal ear cleaner. So I don't know, once a week or however often you're going to do it. And actually, I had a fairly good response with it. With those ones where, where they've got that really chronically cobblestoned, inflamed red ear, and you just think, actually, without that on board, I seem to struggle to really keep on top of it. And it prevents you from using those systemic steroids and especially for the, because you get the odd few clients where the allergies in the dog is just pretty much manifesting in the ears. Like they might lick their feet a little bit, but it's manageable. And people don't really want to use long-term meds for those dogs. Like even if you suggest Apoquel or something, sometimes they just don't want to use it because they don't see it as bad enough because it's just the ears. So for those people, I find it really helps. But I don't know about you. I don't know what you use.
Yeah, if it's just the ears, yeah, I'll definitely. And the other one I'll say is, we'll do the Apoquel. It will help the ears. I try and get that across to them because, skin is skin in the ears. But I'll say if you need an extra hit down the ears, you might also need to do some steroid down the ears as well. And my other little ranty thing that I say in consults is I don't want you to see muck in those ears and think that's an ear that needs cleaning. I want you to see muck in those ears and think the allergy is not sufficiently controlled. I think that's a massive point of difference, because what I want to encourage them to, that I say to them, look, the ear skin's really simple. If it gets upset by the allergy, you get yeast overgrowth, but you also get mucky discharge often. And I say it's your clue that the ear skin is red. So what I want you to do is rather than just clean the ear, which is just a symptom of the inflammation down the ear skin, I want you to use a steroid down the ear so that you calm the allergy down. You get to the root of what is making that mucky discharge. So that's
Yeah.
my little thing that I use. But yeah, Resicord,
Yeah.
yeah, yeah, good. I was trying to work out, I know, we used to use for so many years, and when I worked with the derm specialist, she used to use Cortevant spray in the ears. It's such a cool steroid because it's one of those ones where the steroid goes potent in the skin, but none of it gets absorbed into the body.
Okay.
We know from thyroid cats that the ear skin's amazing at absorbing certain
Yeah.
drugs anyway, because the thyroid cream we put on, that's where we put things, isn't it?
Yeah, for sure. And I think the only other thing that I would say that I've learned sometimes, I mean, you'd think it would seem really obvious if you're saying that you're going to give patients an ear medication that they're going to put them in their ears, but sometimes people just don't quite get it. I've now found that I have to be really, really obvious with owners as to how to apply medication because I think we've all seen the patients where the owner's been cleaning the ear, but they've been cleaning literally what they can see. They don't understand that they have to clean the ear canal. Like that's something that I think happens quite a lot. It's going to sound like I love flea treatment, but I've got to go back to it quickly because it's really funny. There was actually a lady that I had once that I gave a Simparica to because we'd done a skin consult. And she said her dog's really itchy, blah, blah, blah. Gave it some meds. Anyway, gave her a Simparica, forgot to write on the label, give orally or give by mouth. And she came back about 3 weeks later and she was like, my dog's still really itchy. I think it's still got fleas. And I was like, oh, okay, did you give the Simparica? And she went, yeah, but I don't think it really worked. And I was like, oh, this is weird. Anyway, I looked at it, it was still absolutely crawling in free of fleas. I said, I can't remember how it came about, but anyway, it turns out that she'd popped the Simparica up its bum, like she'd literally put it into its bottom. And because she thought that was how it got absorbed. No idea. So now I'm like, give this orally or like whenever I dispense any medication, I make it so, I mean, I know we should do anyway, but I make it so clear on the label exactly how to administer it, because there are the odd few people out there that would just do crazy things for some mental reason. Anyway, moving on to something a lot less silly and something we always really want to get as perfect as we can for various reasons. I think maybe it's worth talking about euthanasia protocols and the consult and how we approach it. I know it's something we all do every day, but I think there might be maybe some top tips and things that we can discuss and things that work for us. So,
Yeah, it's macabre, isn't it? But
yeah.
my most novel thing, and I don't know if everyone knows this, is about propofol, particularly for big dogs. And I really hope that the vet that taught me this is listening, because I don't know who she is. But I had to put to sleep her dog, and she couldn't be there because she was somewhere, I don't know, out of the country or something. And she said to me, "Can you give it propofol for the first half of the euthanasia, and then pentobarb for the last half?" And she says it's something I've been doing for the last few years in my large dogs, and I find they go much more gently. So, have you ever done this?
No, never. But then to be honest, I think I've moved, especially in the last couple of years, I've moved much more towards sedating things before I put IVs in. Because for me, I think the most stressful part of the whole process is getting the IV catheter in. I generally find it's a really nice process because they're so sleepy, they don't mind the catheter, and then I just give the pentabarb and don't have to worry. But I think I can see the principle behind it. But do you find it really works? Have you done it since?
Yeah, I've done it twice. I did it with her dog. Obviously, well, we Dom talked it, I think, as well. But I did the propofol, and it was certainly true that the dog was very beautiful. Now I can't tell from one, obviously, but yeah, it just went to sleep in a really nice way. And then I did it again on something else when I thought I could get away with sneaking out some propofol. I can't remember because obviously it's a little bit. I don't know if bosses another moment when bosses everywhere are going to go, "Oh, he's stolen the propofol to do euthanasia." But,
Yeah.
and I think it is good. I think, she said she got it from an American vet, and, maybe it's bigger in the way they do things. But, so yeah, it was a little bit out there when I first heard it, but yeah, no, I think it's good. The sedative though, I'm getting really frustrated by, obviously with Domtor. I used to do for like years ago, I used to do low dose Domtor, but then they would sometimes vomit. So then I went like higher dose Domtor, but I don't get the vomit nearly so much, hardly ever.
Mm.
But I just get those horrible agonal gasps, which are far stronger, aren't they? Don't you
See,
get
I
that?
actually generally find that if I give it, so I always give high dose Domtorb, like I give enough to like properly knock them flat, which sometimes shoots me in the bum because it makes it more difficult for me to get my IV in. But hey ho. But anyway, it for me makes it lovely, like, they're just not stressed, I get that IV in really nicely, the owners aren't stressed, and I even now say to owners, or especially if it's a cat, I'll say, like, "Oh, she might have some little old lady veins, bless her, so it might take me a couple of tries to get the catheter in, but she's not gonna know anything about it, she's super sleepy," and then it gives you sort of a bit of onus if, like, they've got absolute crap veins and you're trying, like, 4 times to get it in or something. Um, anyway, I find the agonal gasping for me is less about the sedation and more about how quick I give the pentabarb. If I always find that the ones that gasp are the ones that I'm panicking to put to sleep. Like, I don't know, if it's something that's really distressed and the owners are just like, just do it. Maybe because I'm, from more of an ECC side of things as well. I see a lot of those kind of ones. The ones that I shove the pentabarb in as quick as I can always gasp, always. Whereas the ones that I give really super slowly don't. And I mean, I always warn owners anyway that it can happen so that they're prepared if it does. But for me, it's about speed that I give the pento rather than the sedation. So I don't know whether that's more of a link. I don't have any evidence behind it to say why, but that's what I've found, to be honest.
I love that. I've never heard of it. I'm definitely gonna do my next one slower and see what happens,
Yeah.
because I think you could be right. Because I think I give it quite fast because I don't know. How slow are we talking that you do it? Like over 45 seconds, a minute?
Yeah, I mean, if it's because it always feels slower than it is, doesn't it, really? But like, say if it's a generic cat and I'm giving like, I don't know, 4 to 5 mils or whatever I'm giving, I'll give it over about 45 seconds, something like that. And actually, for my big dogs now, I actually warn the owners and say they are a big dog, so it's quite a lot of injections. So it's going to take me a few minutes to get the whole thing in. So I actually warn them it's going to take a while so I can go nice and slowly because I know that if a big dog gasps, it's horrible. If you get like a rotty that like afterwards the owners are like, "Oh my God, it's horrible." So yeah, I just find it works so much better. So,
It's worse with the big dog. I
but
think it is worse with the big dogs. Yeah.
yeah,
I can't
it's
wait
just
to
more
try and, well,
dramatic.
sounds a bit evil, but I can't wait in a way to try that. Yeah.
Yeah.
Oh, that's
Yeah.
cool.
I mean, if anybody knows of any reason why or they find the same, then obviously let us know.
Yeah, the thing I really want to do to start doing more, and I'm not, I need a bit of guidance on it, I think, is I just feel like alfaxalan has a role here in terms of,
Mm,
like you say, with sedation and things, because it's a nice sedative when used alongside metatomidy. I think it's quite gentle and peaceful as long as it's with another drug, and
yeah.
then you're not going to get the nausea. It's subcut. You could even give it. I think it probably work. Oh yeah, do you know
Yeah.
what? I do my metatomidy and torb subcut and
Do
as
you?
well. Yeah, because I know some people go, "Oh, it doesn't make any difference," or whatever, but I find it's much more gentle for the patient, and it just works because 'cause I'm using such a big dose anyway. I think it works perfectly fine for me.
No, I think if you find it works for you, then go for it. I think the only thing that puts me off Alfaxan is, I mean, I've always been a Profile girl anyways, but especially for dogs, it's such a massive quantity to give. And if you're giving it IM for sedation, I just feel like it's so mean.
Oh, do you know what? There's one more thing I could add to this, and I don't right, look, again, look, I think it depends on you as a clinician, but I don't think I'll ever take the patient away from their owner on a euthanasia to put the cannula in, etc. I don't do that
Mm,
because for me, in my hat, I'm like, I feel confident. If I can't get it, I still feel confident that I'm pretty good at it. That's a luxury that I have because we do a lot of emergency work. We have a lot of NAF veins, but
mm,
I like the transparency of what we're doing, and that my the contract that I think they come to us with is that we're gonna do this in a nice way, and
mm.
if we take a patient away and the owner's not seeing part of the process, I don't feel we're fulfilling the contract that we're gonna make this nice no matter what.
Yeah. I think it depends on the patient because I know that I used to do that for the ones that I didn't sedate. So especially dogs, if they were ambulatory and the owners either didn't want me to sedate them or I didn't feel I needed to, I normally would take them out the back to pop a catheter in, but I don't ever do it now because I sedate nearly all of them, or they're so lethargic that they're not bothered about me catheterizing them anyway, in which case I always do it in the room now. But I think again, that's come with confidence. Like the more qualified I've got, the more experience I've got, the less worried I am about being able to hit the vein. So I think that sort of comes with it as well. But yeah, I think there have been other things as well that I found that have helped. Like I've now found I have this one line that I say, it sounds a bit bad because it makes it sound like I do exactly the same thing in every euthanasia, but I have this one line now that I found really comforts people and works really well for all my euthanasias. One of the very first ones that I ever did, I think it was a cat, and I drew up because it was a big cat, so I drew up 5 mil. It was really sick, and I think I'd given it a mil, and I knew it had already gone, but it's in the syringe, the needle's in the catheter. I'm just going to give the whole thing anyway. And they were so upset. They'd had it for 18 years or however long it was. And I said to them after she'd passed, I said, just to let you know, you've done a really lovely thing. I think she was really ready. I know we give an overdose anyway, but I said something like she only needed a fifth of what I'd drawn up for her and she'd already gone. And the relief on their face was like, oh, we've made the right decision. And since then, I do it every time because it works like a dream every time. So to put that into contrast, if they don't die quickly, sometimes I'll say, if I've got any suspicion that there's cardiac disease going on, sometimes I'll say, the heart is just not working quite as well. So the blood is taking a little bit longer to get where it needs to go. So the drug just takes a little bit longer to work. So it just shows you how poorly they were. And honestly, if you say something like that, it's like icing on or cherry on top of the cake. It just like smooths out the whole consult. And if there was any gasp or anything like that, it just makes them leave feeling so much more settled and happy about, well, not happy, wrong word, but like it's
Cherry
gone
on the
well. Do you know
cake,
what I
Charlotte.
mean?
Yeah, I think that's
Yeah.
exactly what they're thinking. Love it.
But
Great
you know what I
analogy.
mean? It just makes you feel like you've done a nice job because they leave feeling so much more relieved and like they've made the right decision. So for me, I just find it works a dream every time. So again,
Yeah,
little top tip.
weird, like convergent evolution. I think I do the same, weirdly, for both. Gosh, what's the wrong of it? But yeah, we're just trying to look after people's feelings, aren't we? We want them.
Yeah.
Yeah, I don't know. Yeah, no, I do
Yeah.
that.
Because at that point the animal's already passed. You're not doing anything clinical. It's just about supporting people, isn't it? And if you can say something that's going to make them feel better, I don't think that's ever a wrong thing to do.
Oh, when you said it's about supporting people, you just reminded me, when you get the client that they've decided to euthanize their pet and they come in and they
Yeah.
just want you to confirm that euthanasia is right because they've
Yeah.
spoken to their partner, they've spoken to their kids, and they've come in and they think euthanasia is the right thing. And so then you're straitjacketed into going along with it, aren't you? And you have to come up with something support. And every now and then you'll get one where I'll think, well, I don't know if it's in my head, I'm going through it and thinking, God, it could be like, I don't know, it's a cat that's eating loads and losing weight. And you think, well, it could be hypothyroid,
Mm.
but the owner's come to this decision. So, have you had, is this an experience you've had?
Yeah, I mean, I had one literally not was it yesterday? Yeah, yesterday. I had a 12-year-old cat come in that was non-ambulatory paraparetic, so it was completely off its back legs, but it still had movement. So it had nociception, it was still able to move them, but it looked like a spinal Frenchie. It was like sitting on its bum. It had anal tone, it could move its tail. Prognostic indicators were looking far better than I was expecting because when they said it's off its back legs, I was like, oh, well, if it's got no anal tone and no nociception in either of its hind legs, like that's it for me. Like if they've made that decision, then fine. But they wanted my opinion, and I was like, well, this might get better. It might because we don't know what's causing it. If you want bloods, advanced imaging, blood pressure, if you want me to do workup, I might be able to tell you what's going on, and it might be something that we can rehab her and we can give her physio, and you know, she might do better, but there's no guarantee. And I think that was almost worse for them because obviously I couldn't lie and be like, 100% the right decision. She's not going to recover because obviously, like, you can't lie to make people feel better. But equally, I think they wanted me to say, yeah, it's definitely what I'd do. But then sometimes you just can't say that. So they did end up putting her to sleep, and I had a very frank conversation with them. And because they didn't have the funds, they had two kids at home. They didn't have the time to be rehabbing her and making sure she didn't get urine scald and all that sort of stuff. It just wasn't right for them lifestyle wise as well. And I don't think it was right for the cat either. She was getting quite distressed. But yeah, I think it's people just need the reassurance, don't they, a lot of the time. But
It's finding
anyway,
the right set of words to make them feel okay without putting yourself in a
yeah,
situation where if they suddenly change their mind and then the cat does get better, you haven't been the one but it's a really
yeah,
tricky thing. I'll tell you someone who does this really well is Rob at Vet Shack. I think he seems to he sometimes at the odd time I haven't worked with him much, but sometimes he gives me like he says something to me about how to handle a situation, and it's the
yeah.
perfect set of words. It's a really important skill that I think we have to
Yeah.
have.
I think honestly, some people just have the perfect communication, don't they? And Rob is amazing at that. So I think you just have to have the right way of speaking to people, don't you? And if you can nail that, your consults will be a dream. Whatever you're having to discuss, you just need that perfect communications. Okay, so moving on from difficult conversations with owners to difficult new concepts to get our head around. So technology is changing so much and so fast nowadays that I think we all struggle to keep up sometimes. But what do we all think about the new technology advances in the vet world? So, WhatsApping clients, sending them photos of their animals post op, virtual consent forms. I know us two have both worked somewhere that does a lot of paperless consent forms and WhatsApp messages to clients. But I mean, what do you think about it?
Well, it can be done well and it can be done badly. At worst, it's slow. If you've got six admins to do in the morning, and in let's say the old days, or when it's papered, you'd have all the consent forms all pre-done, all printed out. The little collars they wear around the neck with the tags, the ID tag,
Yeah,
all in the clipboard. And you go through. You can see them all, which is a visual. Oh, there's seven admins today. Oh yeah, blah blah blah. There's so many things there in a papered scenario kind of thing, super quick and efficient. It can be done badly where you have to create it, you go through, you have to, oh, we haven't logged in on the tablet, you haven't to, the whole thing takes an extra 5 minutes. But 5 minutes times seven is 35 minutes. And that's a huge, but when it's done really well, and it can be really good.
yeah. Yeah, I think I love the WhatsApp service. I think it's great because when sometimes you're really busy and you think, oh, I've just got to update the owner with something, or you just think, I need to call this person and they're going to keep calling me if I don't call them back yet, but I just don't have the time. If you can just say to one of your nurses, can you just quickly send them a WhatsApp to say that I'm going to call them in 20 minutes or something, ideal, or sending a photo of an animal as it's recovering so that they know that they're okay while they're waiting for the vet to call them back. or even to say, we're chasing the lab, we haven't got your lab results yet, but we'll be in touch with you. It just touches base and it's so quick and easy. And the same for if owners want to get into contact with us, just ask a question, but it's something that we don't have to reply to right that instant. It's nice, but I'm a bit the same as you in terms of consent forms. Sometimes I find it a little bit clunky and awkward, especially for older clients. Like, how many times have you gone to try and admit a dog and used like the tablet for them to try and sign virtually on, and an old person has gone, what, like, how am I doing that? And they don't understand how to use it, and they don't understand that the pen isn't really a pen, it's like a touch screen pen, and they're like, where do you type? And they can't really see it, and I just find it really awkward. And it's especially for euthanasia consults, I hate them, because I just think it's, for me, there's something that feels really impersonal about like giving them a tablet to sign on when we're just about to euthanize their pet.
Yeah. No, I'm actually okay with the tablet. Don't you have the problem with women with long fingernails? On the tablet, they can't do the signature because
True.
their fingernail gets in
Yeah.
the way. That's the only. I've not had a more
No.
senior and experienced person have a problem with it. WhatsApp I've been using for years, even when I was in general practice,
Mm.
213, 212. I know one clinic I work at where they do a photo when the pet comes in. They do a photo. They do a WhatsApp kind of going, your pet's going into theatre now. They, a photo with them eating their post-op meal, whatever, and the clients love it. With the feedback I hear is very, very positive. So, yeah,
Yeah, yeah. I think it's good, and I think we need to try and change with it, don't we? We need to try and change with the times and keep up to date so that people know that, because everything is virtual, everything is instant nowadays, isn't it? You get answers really, really quickly. People are so used to searching everything on ChatGPT and getting an answer right that second. So I think we need to keep up to date with those instant updates as much as we possibly can. What do you think about AI use in the vet world? Because I always worry, like, are we eventually just going to get replaced by computers that can just tell people exactly what's wrong with their dog? Because, have you ever tried typing a set of symptoms into ChatGPT and seeing what it comes out at? It's amazing. Honestly, have you ever tried it?
yeah, lots.
Yeah.
Was it better than you? Because when I did it,
Honestly,
it's way better than me.
yeah. I mean, even years ago when I didn't really know what it was, I typed in, I remember, did I tell you about that bulldog, the 18-month-old that had the lymphoma with IMHA and IMTP? I don't know if I said it on the
Yeah,
podcast or
that
not.
sounds
Yeah.
familiar.
Yeah. So anyway, because it was really new then, and I'd already started treating her anyway. But I thought, I wonder how well it works. So I typed in her signalment, typed in what she had, and said, "Give me a chemotherapy protocol for this dog." And honest to God, it was word for word what the specialist had sent me. It
Especially
was
if she used it
amazing.
too, probably. That's why.
Yeah, maybe. But when you think it's incredible, it's like, anyway, mad. So I wonder how
Yeah.
many of us are using it every day.
I do two of my jobs in new practices. If I get a history from a previous patient, and it's kind of, when you get like a 50-page history because the client's had whatever going on with the last practice, I stick that into AI, say summarize that. It tells me everything in really concise
No
detail. It's
way.
the best thing in the world. It'd be brilliant in after hours if people had a history.
That's so good.
Yeah, I can't. It's
Yeah.
yeah. So there you go. And then and it says what's their latest flea and wormers they're on. When was their last vaccines? I'll say when was their last distemper vaccine. So I know like when the
Yeah.
DHP is every 3 years. I know when to do it instead of having to trawl through it. And then I'll know their
Yeah.
history better than they will because they'll come in. And we'll start chatting about it, and I'll go, legs are a bit slow now. I'll be, oh, yeah, that cruciate on the left leg, like 2007, didn't you? And they'll be like, oh, no, it's 2009. I'll be like, well, I think it was 2007. And they'll be like, oh, yeah, it was. Yeah, but I always get myself into trouble. We're not meant to do this, are we? Because it's not a safe thing, is it? If we put client
Yeah.
information on AI, that's not safe. So I'm not doing that.
No.
Everything I just said,
Yeah.
I blank out the info first.
Yeah, it's so clever, and it's got so much scope for how useful it can be. And I don't know whether a lot of practices are using some of the AI powered technology now. When you can scan your microscope slides in practice, and it sends it off to a pathologist virtually and things like that. It's incredible how it works, and like you can do your platelet counts and your red blood cell count AI powered. But one thing I did want to mention, I was reading, I think it was must have been one of the BSAVA journals the other day, but they have released a new AI powered tech thing within the BSAVA library. So there's this thing called Rover. Have you heard about it?
Yeah, yes, I've heard about it. Yeah, everyone can do this, can't you? You can direct it to your resources, and then it uses your resources
Yeah.
to answer. I
Yeah,
don't know.
true. I mean,
Is that clever?
I don't know how well it works. I've not actually tried it, but apparently it's supposed to use, like you say, all of the resources that have ever been published by the BSAVA, that it says you can type into, like your equivalent of ChatGPT, but on this rover, you can type in any question that's veterinary related and it should give you an answer based on the BSAVA literature, which is quite cool. I think you get a certain number of searches free, but then some of them you have to pay for. So, but then I guess it's like anything, isn't it? But I don't know how good it would be. But anyway,
Yeah,
yeah,
you
it's
know
just
what?
something to consider.
They've paid some AI advisor, and they've gone, "Oh, you can do this," and people have gone, "What? So
Yeah,
clever, we're going to do that." And they
yeah,
spent that about £5,000 on that AI advisor. But look, there's like specific ones for medical research, which are really good as well. So I don't know if you need to. Yeah, I think
yeah.
yeah.
I think it feels like they've also hit the market a little bit late as well, because so many people are already using it that now they're marketing it, and I feel like it's probably a little bit late. But I don't know. If anyone uses it, then let us know if you think it's been useful, because it's just really interesting. But anyway,
Yeah.
okay, so roundup time. We've covered loads again today, from dental chews in dogs to fleas and allergy testing to euthanasia protocols, and also our new tech and AI in the veterinary world.
We hope as ever you enjoyed listening, and remember to get in touch if you have any comments or suggestions to improve the pods for you. And any topics that you find interesting and you want us to cover, just send the word.
Yeah, absolutely. We'd love for you to get in touch. But for now, thank you very much for listening. Join us again next month for our first 2-week takedown episode of March, where we'll be covering subcut ketamine, ovariectomies.
We discuss anesthesia faux pas, must-haves in your anesthetics, and favourite GA protocol for neutering in our small animal patients.
We can't wait. Until then, it's bye from me.
It's bye from me. Take care. The content presented in the Chatty Vets podcast is intended for licensed veterinary professionals and is for informational purposes only.
Views expressed are those of the host and guest and do not substitute for clinical judgment or individualized patient care.
Drug dosages, protocols, medical advice discussed should be verified against current literature and manufacturer's guidelines.
Class and its creators are not liable for any errors, omissions, or adverse outcomes resulting from the application of this information.
Always consult relevant laws, regulations, and institutional policies in your practice. Listener discretion is advised.